What's up, everybody? It's Pastor Derek, and it's a joy to come to you. And I have some good company today. I'm hanging out with Dr. Paula Young, and she is the medical director of community affairs,
Community health. Yeah,
with Bon Secours. But more importantly, she is a very fine member of our congregation, and just so grateful for the work that she does with our health and wellness ministry here. And we have an opportunity to have some moments of clarity on COVID-19 is what we're calling this today. See if we can dispel what is true and what is not true for our viewing audience. So first and foremost, what's up, Paula? How you doing?
I'm doing well, Pastor Derek. Thanks for having me. This is a great opportunity to share some wonderful and needed information with our congregation.
Yeah, it's a joy. I think our greatest defense against bad information is to make sure the good information gets out there.
Exactly.
So thank you so much for being with us today. So let's jump right into it. We have some questions that have been formulated that I want you to take a stab at, and we'll just have a discussion around it.
Sounds good.
So let me start with this. Can a COVID-19 vaccine can it make me sick with COVID-19?
So no, it's not going to make you sick with COVID-19. This vaccine does not have live virus. Okay. So this vaccine is going to have your body to be able to simulate the response of a protein within the coronavirus. Okay. And then if your body gets exposed to coronavirus, then your body has already built the immune system response needed in order to fight the virus.
Yeah.
But no, it is not a live vaccine, and it will not give you coronavirus.
So you hear it from Dr. Paula today that when you get the vaccination, they are not putting the virus into your arm.
Correct.
All right. Thank you so much for clearing that up for us. Here's a second question for you. If I've already had COVID-19 and I have recovered, do I still need to get vaccinated with the COVID-19 vaccine?
So absolutely. So if you've had the virus, you do still need to get the vaccine. There's been talks of people having antibodies. Once again, this is something new. We learn more about this virus each day. We don't know how long that immunity lasts. And we do think that, yes, you definitely need to still be vaccinated. There is one caveat to this scenario, however. If you've had mild or moderate disease, you may have received a treatment by an IV infusion with your monoclonal antibody.
Okay.
If you have received that treatment, you are still to get vaccinated. However, you do need to wait a length of time since getting that infusion. So your doctor may say, oh, you need to wait 90 days before we can do that type of, give you the vaccine. But should you get it? Yes. And a lot of people who are getting the disease are not getting that monoclonal antibody. I just wanted you to have that for full knowledge,
that's
full
helpful.
exposure. But yes, if you have had coronavirus, you should still get the vaccine.
Got you. I don't need to rest on the laurels of thinking that the antibodies that I had are everlasting.
No, they are not.
Got you.
And we are still learning more about that.
Got you. Lead into the next question. I saw an article this week about I think maybe 4 people in Oregon who had gotten their second vaccination shot, but then tested positive for COVID-19. So here's my next question. Will COVID-19 vaccination protect me from getting sick with COVID-19? After I get my vaccination shots, what's the real deal?
After you get vaccinated, could you still get COVID? The answer is yes. Just like after you get the flu shot, could you still get the flu? The answer is yes. That's why once you get your vaccine, you still need to wear your mask. You still need to wash your hands. You still need to social distance. Okay? So yes, it can happen. Be aware that it can happen. And we still have to make safety decisions as we're going through our day to day.
Yeah, absolutely. So folks, just be clear that we want to make sure you understand that even after you are vaccinated, you can still get infected. But the vaccination, to my understanding, will lessen the impact of the virus. Is that correct?
Yeah, we do believe that having the vaccine, for some people who may have succumbed to the disease, having the vaccine may be that decision for life for you that allowed you to overcome your illness, or that it not be as intense or as severe as it could have been.
Okay.
And even when we talk about this, having your vaccine is also the thing that's going to stop. You hear about the mutations of the virus.
Yeah.
So when we're getting the vaccines, that virus mutates when it's in people's bodies.
Yeah.
It needs the host.
Yeah.
So having that vaccine decreases the virus's ability to do that. And that's a good thing. We need to stop the variants from occurring and do our part in it to make that possible.
Absolutely. Thank you for that. Next question. Adults of any age with certain underlying medical conditions are at increased risk for severe illness from the virus that causes COVID-19. Should they take the vaccine?
Once again, yes.
Okay.
Yes.
Okay.
So if you have any kind of other conditions that could make you more susceptible to being having COVID or the virus, then absolutely you should get the vaccine to protect yourself as well as you can.
Yeah.
So we are encouraging everyone with underlying conditions to get the vaccine.
Absolutely.
And I will say there are caveats for the person that is the most severely immunocompromised.
Yeah, right.
And in those situations, you are going to want to talk to your physician about getting that vaccine. It is still likely that your physician is going to still tell you to get the vaccine. But I do want you to have the conversation in those situations.
Got you. Okay, so folks, make sure you're talking to your medical professionals. There's a lot of bad information out there. And people, oftentimes are getting their, information from, iffy and sometimes sketchy sources. As a medical professional, where would you recommend that people look to get their information on COVID and the vaccines associated with it? What would you recommend to the novice out there looking for good information?
Just Google and go to the CDC website. That is where the professionals are getting their information. It's made very public for there to be public knowledge about it. There's not any secrets. There's full transparency when you go read those websites, sponsored by the CDC or information given on the CDC website. And it's very as specific it can be for each of the situations. Now, this is a moving target. So I'm going to tell you that information changes every time I read it. I do these talks. And each time, the message may be different. I learned something different or something has changed. So I want you to read it, but I want you to read it again. So you can stay aware of what's going on. And the CDC website is the best place to go for the information and get the facts.
Got you. So let's talk a little bit about access in terms of where we are right now relative to the vaccine. Right now, who is being prioritized to receive the vaccine in the phase that we're in? And if you are in that particular tier of the population, how do you sign up to get vaccinated?
Now, that is a great question that I get a lot. We are in the 1B phase. Okay, the 1B phase are essential workers, even people in correctional facilities. And even school teachers. So when you go to the CDC website, you're going to look at the phases. You're going to pick your phase because it's going to tell you who is in each criteria. And then it's also going to tell you how to register for the vaccine. We have a shortage. We have a limited supply of the vaccine. This is not going to be forever. There's a limited supply, but there is currently a limited supply. And so we have to give it out in an equitable manner to those that we think will be the most severely affected from the knowledge that we have.
Absolutely.
And so that's why these categories have been created. So I urge everyone to go to the CDC website, see the category that you are in. Mm-hmm. But right now we are doing 1B, which is 65 years or older. Mm-hmm. Okay. People with some underlying medical conditions. Mm-hmm. Okay. And then some frontline workers.
Okay. Gotcha.
Are necessary workers.
Right. Absolutely. I feel you. I know what you're saying.
That's the word I'm looking for.
Yeah, absolutely.
Yeah.
Talk to I guess for the pessimist among us, let's talk a little bit about, really briefly, just to address the expedience with which the vaccine was, I guess, created and approved. For those who would say it was done so quickly, therefore, I shouldn't take it. What would you say as a medical professional to individuals who would think about that?
Yeah, so that's one, because a lot of people have a hard time wrapping their mind around this came so fast.
Yeah,
I can't get it because it came too fast. Mm-hmm. So this vaccine is based off of mRNA. Mm-hmm. This is not unknown to scientists.
Sure.
With that said, when you have the whole world mm-hmm. focused on a solution.
Yeah.
Okay.
Yeah.
And with the advances we've just seen in knowledge and technology over the years, they were able to come up with this quickly. Mm-hmm. They really mm-hmm. were. And with that said, it still went through the phases needed for emergency use with the FDA. Yeah. So it has shown its safety. It has shown its efficacy.
Yeah.
And so using it, even though it came out quicker than maybe any vaccine in my lifetime, because so many vaccines in my lifetime were already created.
Already there.
Were already created. So it has been adequately tested and by the FDA to show that it does have safety and it does have efficacy.
Would you just very briefly, for folks who may be watching us who don't know what the term means, herd immunity, and us trying to get to some semblance of herd immunity in order for some sense of normalcy to return to society? What's the easiest definition of herd immunity?
So when we talk about herd immunity, mm-hmm. It relates to the fact that many people mm-hmm. in your community have created the proper antibodies mm-hmm. to be defended against the disease.
Yeah.
And when that happens, then the disease is less likely to be able to present itself mm-hmm. to the community. This one is tricky.
Yeah.
And people talk about herd immunity. And you hear I've heard some of the stories of people just saying everybody should just go get infected. Mm. And we achieve herd immunity.
Wow.
We don't encourage that. We don't encourage that as a form of herd immunity. Yeah. We would like people to be appropriately vaccinated when it is your chance to get vaccinated.
Absolutely.
And even as we're learning more, this may be the type of thing where we have to get a booster shot. Mm-hmm. It may be the type of thing where the virus does continue to change, mm-hmm. and we have to get shots every year during the season. Yeah. If there is a season for this.
Right.
Once again,
we're still learning.
A moving target. We are still learning. Yeah. So that sort of speaks to herd immunity. Yeah. But we're still following this virus to see what we're really going to need to do to maintain health and wellness.
Absolutely. And people who may be afraid of side effects mm-hmm. of getting the vaccination, what would you? Are there side effects that have been identified, and should folks be afraid of those, or what would you say to people who are hesitant because I'm afraid of the side effects?
Yeah. So the side effects are the typical side effects mm-hmm. that you can get that a normal vaccine would cause. So maybe some soreness, mm-hmm. some redness mm-hmm. of your arm. Mm-hmm. Definitely keep moving it afterwards. Some people are getting some headaches.
Yeah.
Some people are getting some fever. Some people are getting some diarrhea. Some people are getting some vomiting.
Mm-hmm.
You can get those things.
Yeah.
And we're definitely seeing that there's more response in that way with the second dose
Okay.
of the vaccine.
Okay.
Be aware.
Mm-hmm.
You know, it doesn't mean that it's working.
Mm-hmm.
You know, let it run the course.
Mm-hmm.
But no need to be fearful.
Mm-hmm.
Or to be scared.
Yeah.
Be educated.
There you go.
That's what I'm saying. Just be educated. For people who may have had an allergic response
Mm-hmm.
or anaphylaxis to a vaccine,
Mm-hmm.
then you do need to let the clinic know when you're going to get your vaccination.
Mm-hmm.
The providers there, we always have like the epinephrine pens if needed
Mm-hmm.
for some type of allergic reaction, or if you're normally the one, some people have their own EpiPen,
Mm-hmm.
some people bring their own Benadryls and
Mhm.
things of that nature. So if you need to, once again, be prepared, be informed
Mm-hmm.
that you can still have the vaccine,
Sure.
but let's do it in the right way.
Absolutely.
Now, people allergic to peanuts and seafood and things of that
Yeah,
nature,
yeah.
well, there's no peanuts, there's no fish, and there's no shrimp in this
Yeah.
vaccine.
Right. Absolutely. And finally, we know how, COVID-19 has disproportionately impacted Black community and
Mhm.
people of color in general. In terms of what you're seeing for people who would say, well, they're not giving us the shot. What would you say to our community in terms of where we are in terms of availability, and even if there are, if the availability is low, what would your advice be to them in terms of would you tell them to continue to be persistent,
Mhm.
continue to be patient? What would you say, particularly to our community?
So this is where we need to be a community.
Yeah.
When it comes to this situation,
Mhm.
knowing that there is a limited supply,
Mm-hmm.
this is when you go to your elderly neighbor.
Mm-hmm.
This is when you go to your grandma. This is when you are the one who logs onto the computer
Yeah.
to go to the health department website to get people logged on.
Yeah.
This is when you get the number for the primary care
Wow.
provider.
Yeah.
And you call that office and you ask, can my grandma or whoever get their vaccine? We need to
Yeah.
pull together as a community. We need to be advocates
That's right.
for each other. We need to make sure people have a ride to get to where they need to get to,
Yeah.
that people have the technology at home.
Yeah.
Some providers now are doing virtual visits. I've been doing virtual
Mhm.
clinics.
Mm-hmm.
Make sure that you're there to help whoever log onto the computer
Mm-hmm.
so that they can talk to their doctor about what they need.
Yeah.
So we as a community
Yeah.
really need to support each other and lift each other up during this time.
Absolutely. I mean, and that's the communal thing to do.
Mhm.
And what we don't talk about enough is that's also a Christian thing to do,
There we go.
because the Bible teaches us that we have to love our neighbor. And I can't think of a better way to do that. Well, Dr. Paula, thank you so much for hanging out with me today.
Sure thing.
And this is the first conversation of this kind, but I'm prayerful that we'll be able to have many more as we continue to try to set the record straight. Not just about COVID-19, but medical issues in general that impact our world and particularly our community. So thank you for lending your expertise to us this evening.
Sure thing. Thank you for the opportunity.
Yeah, absolutely.
Appreciate it.
Thank you so much. And thank you all for tuning in. We have a link that we're placing on this evening where you can click on the link, or you can go to the link and find the information that Dr. Paula was talking about relative to the CDC, and get the right information from the right places. God bless you all. Continue to pray for each other, care for each other, check on each other, and we're going to get through this together. We love you. See you soon.